Good afternoon. Would the members of the House please come to order? I'd like to welcome all of the delegates. Because of the cancellation of our in-person meeting, the invocation will be provided through video by Rabbi Jonathan Jaffe of Temple Bethel of Northern Westchester. Rabbi Jaffe, your invocation, please.
Shalom. My name is Rabbi Jonathan Jaffe, and I am honored to serve as Senior Rabbi of Temple Bethel of Northern Westchester in Chappaqua, New York. I deeply appreciate having the opportunity to address you, especially in this time of pandemic in which our doctors, nurses, and healthcare workers are more vital than ever. From the bottom of my heart, thank you for all you do to bring healing and comfort to all of us. And I am grateful to honor my friend, congregant, and teacher, Dr. Bonnie Litvack, in her capacity as president of this esteemed society. Mishaberach avotenu v'imotenu, may the one who blessed our ancestors before us bless the hands of those who bring healing, comfort, and care to those in need. May they be protected from harm as they risk their own well-being for the sake of ours. May this moment of turmoil allow us to recognize the godliness they bring into the world through their actions. The Mishnah, the 2,000-year-old document of Jewish law, teaches, anyone who takes a life from this world, it is as if he or she destroys an entire universe, as Adam and Eve, as individual persons, beget the population of an entire world. And conversely, anyone who saves a life, it is as if he or she sustains an entire universe, for from one life emerges infinite potential and opportunities for lives to come. Therefore, may those who bring us healing find holiness in their endeavors towards sustaining life, our most cherished gift. May they be guided by the eternal values of wisdom, kindness, patience, and care, and may they receive the same in kind. As exhaustion descends and their hands grow weary, may we lift them with our spirit and our gratitude. In this way, we may be united in our time of need. Aseh shalom b'mamav hu ya'aseh shalom, aleinu ve'al kol yoshvei tevel. May the one who creates peace and wholeness above bring peace and wholeness to all who dwell on earth. V'imru, and let us say, Amen.
Please recite with me. I pledge allegiance to the flag
of the United States of America,
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We are honored this morning to have our own MSSNY staff person, Rosanna Arsenian, lead us in the national anthem. Rosanna will be providing the Star Spangled Banner virtually. So Rosanna, please.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight, oh, the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there.
Frank Dowling. Is a quorum present?
Mr. Speaker, there are currently 299 delegates credentialed and 192 are participating in our virtual House of Delegates thus far.
Thank you, Dr. Dowling. I hereby declare the 214th meeting of the House of Delegates open for the transaction of business. We have the great pleasure to have the Commissioner of Health, Dr. Zucker, with us this year. Because of a conflict, however, he will be presenting by video. The New York State Department of Health has certainly had more than its share of issues this year, and it will be good to hear from the Commissioner regarding the department's plans for the coming year. So we will project Dr. Zucker.
Thank you, Dr. Latrell, for your kind invitation to address the House of Delegates for the MSSNY annual meeting. For several months, I have given talks where I walk listeners through the steps New York State took to beat back an epic surge in COVID-19 cases this spring. The basic facts and chronology remain the same, but with each passing week, the broader narrative continually evolves to reflect the success of our large-scale mitigation efforts, new research about SARS-CoV-2, and the effectiveness of clinical care and therapeutics. New York State has gone from having the nation's highest COVID-19 transmission rate to the lowest after successfully controlling and reversing one of the worst public health emergencies Americans have seen in their lifetimes. We brought infection rates to below 1% for 32 consecutive days at last count. We brought down hospitalizations from 18,825 on April 12th to 410 on September 6th, the lowest number during the pandemic. We brought down the number of fatalities from a tragic high of 800 per day in April to a low of 1. But even as we press on towards 0 deaths and hospitalizations, and even as New Yorkers mask up and keep 6 feet apart, people remain anxious about the future. The Kaiser Family Foundation found that the number of U.S. adults struggling with COVID-related mental health issues increased from 32% in March to 53% in July. The CDC found that by late June, 13% of adults had started or increased alcohol or drug use to help cope with pandemic stresses, and 11% had seriously considered suicide in the past month. Clearly, anxiety is a fundamental part of the evolving narrative. New York is one of the most vigilant states in keeping infection rates as close to 0 as possible. But if outbreaks in other states cannot be controlled, that puts us at risk. We cannot patrol more than 400 miles of drivable border. And with flu season starting up, a second wave of coronavirus could catastrophically strain our hospitals, sending us right back to the caseloads of mid-March. Throughout this pandemic, the Medical Society of the State of New York has provided invaluable services to New York State physicians and healthcare providers. You have been there to guide physicians on how to set up free telemedicine for their patients and to advise them on the best practices for reopening and resuming surgery according to their region and type of clinical care. Your guidance has supplemented and supported the Department of Health's work. We have issued more than 124 guidance documents and moved quickly to leverage telehealth for high-needs populations. Governor Cuomo's Executive Order 202 enabled all Medicaid providers in all situations to use a wide variety of communication methods to deliver services remotely for the duration of the state of emergency. MSSNY has also taken the lead on another critical issue that I would like to discuss in more detail today: physician mental health and well-being. The toll on America's healthcare workers in this pandemic has not been adequately calculated. Even in terms of lives lost, we don't have accurate counts. Amnesty International counted 1,077 deaths of U.S. healthcare personnel, but that was 2 months ago, on July 13th. Within the high-stress environments that COVID-19 brought about, New York State's providers pushed themselves to the brink and beyond. The very scale of the decisions New York made during this crisis often overshadows the fact that each one took into account the physical and emotional needs of our frontline providers. As a physician, as a pediatric intensivist, I spent decades working in some of the hospitals hit hard by the surge. I know that the clock on the wall is working against you. It never stops for you to get your bearings or to try something again. And that's exactly what happened when COVID-19 besieged New York hospitals. From the arrival of our first lab-confirmed case on March 1st, the number of cases rose exponentially, with cases doubling overnight on both March 5th and 6th. During the 72-hour peak of the surge between April 11th and April 13th, 18,825 patients were in the hospital, 5,225 in the ICU, and 4,494 intubated. In normal times, individual healthcare workers may feel comfortable dealing with challenging situations, but with COVID-19, they had to make extremely difficult decisions about who receives care while managing their own mental and physical well-being. At every hospital, in every ward, on every floor, in every hallway, and on every gurney, they made critical decisions focused solely on saving the patient in front of them. And maybe 20 minutes later, they had to do so again for the next patient. They had to repeatedly break bad news to relatives, but they also had to see patients dying alone, separated from worried and grieving loved ones. The moral weight of providers' decisions only increased the pressure and stress, leading to more burnout, more fatigue, but also something called moral injury, the psychological distress of having to take an action that violates one's moral or ethical code. Researchers have found that these kinds of experiences can parallel the symptoms of PTSD and depression and have been connected to an increase in suicidal thoughts. Part of the widespread psychological stress owed to the very nature of a new and unknown disease that frontline personnel can only learn about through trial and error. With frontline healthcare workers in Italy, our heroes essentially served as the world's first responders. The heavy emotional loads they bore in March and April generated knowledge that continues to diffuse the lethality of outbreaks in other states and parts of the world. The death toll in Houston and Miami are lower today because of New York State physicians and healthcare personnel. From the start, New York State and the Department of Health understood this threat and focused immediately on helping our besieged responders. We set up staffing portals and recruited healthcare workers from across the state and the nation. We began searching the world for PPE with the same relentless ardor that we did for ventilators and medications. But we also knew that the best way to get relief to those on the ground was broad and structural, a system in which no hospital supply chain would fail. We saw that for some hospitals there was help nearby, but no way to access it. That PPE was stocked in this borough but running dangerously low just across the river. During the third week in March, Elmhurst Hospital was inundated with patients while other hospitals had capacity, but we had no system in place to immediately share the load. Our solution came on March 30th when Governor Cuomo announced the New York State Hospital Capacity Coordination Center. The center ran on data that we collected daily from every hospital in the state and entered into real-time dashboards with warning signals to track COVID-19 hospitalizations by hospital, hospital system, county, and region. Working with the Greater New York Hospital Association and the Healthcare Association of New York State and New York City Health and Hospitals, the center facilitated nearly 1,450 patient transfers from hospitals nearing or at capacity to other hospitals and alternate care sites, including the Javits Center and the USNS Comfort. The center had at its disposal 350 ambulances brought in from all over the country and other resources that were used day and night to facilitate these transfers. I personally spoke to heads of New York hospitals daily and to the associations multiple times every week, as well as to doctors and nurses and scientists. Every hospital leadership team in New York State had access to a hotline that the center put up and answered 24/7, responding to staffing supplies, equipment, and patient transfer needs. Yes, we provide hospitals with nearly 24 million pieces of PPE, but this new system got each of those pieces exactly where they were needed most. This was the most effective measure we could take to alleviate individual stress on the ground. From the start, the Department of Health understood COVID's threats to everyone's emotional well-being. When cases began to spike in March, the department immediately prioritized mental health, making free remote counseling available to all New Yorkers. The department incorporated a mental health and well-being component within our COVID-19 provider webinars that Drs. Marcus Friedrich and Liz Dufour have ably hosted since the spring. One of the most important points made in these webinars is that encouraging clinicians to have more resilience in a dysfunctional system is not the entire answer. As with military veterans traumatized by war, the last thing overburdened providers need is to be told that they should be coping better. That only adds to their burden, making them even less inclined to reach out when they need help. It is critical that we connect distressed individuals with the information and resources to help them remain engaged, energized, and resilient. But we also need to change our institutional thinking. We need to realize that a distressed healthcare worker needs intervention at the personal, work unit, organization, and societal levels. This is a takeaway from New York's pandemic response that the Department of Health and all of the state's hospitals have made central to future planning. With our low rates of infection, we are well into the important work to institutionalize what we've learned over these past 6 months to prepare for a second COVID wave or whatever pandemic comes at us. We are focusing on 5 critical operations during a pandemic: testing, contact tracing, hospital surge and flex, supply chain management, and personnel. All 5 areas have implications for the well-being of our physicians and frontline providers. First and foremost, comprehensive testing and contact tracing prevents a surge from happening. We are requiring all New York State hospitals to build a 90-day supply of PPE based on each hospital's burn rate during the peak of the COVID-19 surge. With the declaration of a state disaster emergency, we will immediately activate our Surge and Flex healthcare coordination system for the sharing of critical resources so that no single facility becomes overwhelmed. When it comes to alleviating the load on frontline providers, we have learned that everything is connected within a system. Perhaps the biggest lesson of this disease is that it was spread by people, but it was also halted by people. The crisis for New York State began with individual heroes, frontline healthcare workers, thrust into a confusing and unknown situation, doing what the governor often called God's work to save as many lives as they could. We have evolved into a system whereby all of us doing our part has kept infection rates below 1%. New York State will never forget the personal risks our physicians and healthcare personnel took to preserve public health. And now our responsibility lies with helping these brave men and women heal emotionally with the reassurances that this will not happen again. Thank you.
We want to recognize all of the new delegates who are with us today and participating for the very first time in what is really a very different meeting than we usually have. Sandy, would you please project those names? We welcome you. We sincerely hope that the 2021 meeting will give you an opportunity to meet your fellow delegates in person. Various scenarios for our 2021 House of Delegates are being worked on with the hope that it will be held in traditional fashion. Be assured, however, that if it is a virtual meeting, it will be significantly more robust than this meeting. Now I'd like to recognize the list of those who have served our profession for over 50 years. Would you please post that, Lori? There are 198 names of those who have devoted their lives to the health of their patients and medicine. 2 members of the House are included on the list, and we recognize them here: Dr. Madan B. Paul and Dr. Fred S. Fenster. Certainly, we offer your congratulations, our congratulations for this, and commendations to all of you. I hope to join that group in a few years. I'd like now to recognize the folks who have passed in the past year from our House and for whom memorial resolutions have been introduced. I'd like now to have a moment of silence. Could we project those names, Sandy? Thank you. Absent objection, these memorial resolutions will be adopted. Dr. John Lombardo, president of the Medical Liability Mutual Insurance Company, has joined our annual meeting to provide the House with an update. Dr. Lombardo, would you please make your presentation?
Thank you, Dr. Luttrell. It's an honor to be with you today and to have the opportunity to speak with you all in this very first virtual House of Delegates. I'll be brief, and I hope the echo is gone, so you don't have to listen to me twice. I'll outline briefly what we've been doing in close association with MSSNY over the past year. MLMIC, which is our official name now since we're no longer a mutual company, continues to be the largest liability insurer in New York State and has been since our founding in 1975. Our mission remains the same, to take care of our insureds, our doctors, our dentists, our nurses, our mid-level providers, our hospitals, etc. This has been without stating the obvious, this has been a year of incredible strain and difficulty for doctors and patients. And MLMIC is doing what it can to ameliorate that strain and that stress wherever possible. The financial strain has been incredible on all of us. We know that firsthand. It's been very different. It's been very difficult to not just make a living, but to stay in practice as a physician in New York State this year. And we're very cognizant of that. With that in mind, MLMIC was the first to offer part-time coverage for those who had to severely curtail their practices in March, and for those who had to temporarily cease practicing. And also we also instituted a 12-month payment plan, given the stresses of the COVID pandemic. We were successful in achieving from the Department of Financial Services their approval to lower rates this year in most classes, and particularly in those specialties where it was actuarially sound to do so, including internal medicine, orthopedic surgery, and anesthesia. We're very happy about that. We've enhanced our claims-free discounts to provide increased coverage and savings to those who have had claims-free histories. We've created 9 preferred savings programs for IPAs and other large groups of independent physicians that offer discounts of 10 to 15% for qualifying members. This pandemic has created a variety of new stresses with respect to risk management, and we've been in the forefront of providing guidelines and advice to our insureds on how to practice and how to reopen a practice. Things we never thought about in 2019 are now very much on our minds. So we'll continue to do our part, working closely with MSSNY as we always have. We are of physicians, by physicians, and for physicians, to paraphrase a famous president. And I'm always available as Chief Medical Officer for any questions. We have our law firm, Fager, Amsler, Keller, and Shopman, which can answer any questions you have about how to practice in this environment. My email is jlombardo@milmic.com, and I'm happy to answer any questions through that. I don't want to take up any more of your time. And again, thanks for the opportunity and the honor to be with you today. Dr. Luttrell.
Thank you, Dr. Lombardo. There will not be any questions because that's not something that we can actually do here today.
Yes.
So we appreciate your report. I'd like to introduce our Vice Speaker, Dr. Basil, to give us a brief report.
Thank you, Dr. Luttrell. I have a report on the actions of the House of Delegates. The actions of the House of Delegates are meetings are no longer printed, but are posted each year on the MSSNY web pages. Members have the ability to review several years' worth of House of Delegate actions should they wish. Actions on the 2019 resolutions referred to the Council and the AMA are reported by the Vice Speaker on the website. That concludes my report.
Thank you, Dr. Basil. I appreciate that. Some announcements. Those members of the House of Delegates who have taken the time to read the House of Delegates related material posted to the MSSNY website should be aware that the reports we received at the beginning of the year are there. Those reports are included in our informational. The MSSNY Board of Trustees, a report on the activities and status of the Physicians' Home, the MSSNY Alliance, the Empire State Foundation, the New York State Society of Medical Assistants, and the New York State Society of Physicians Assistants. The Speaker of the AMA House of Delegates, Dr. Bruce Scott, will be an observer at this meeting, and I know he's here. I've seen him. And he will be here throughout the House. As you may know, the AMA has been struggling with the same issues as MSSNY, how to conduct the business of the House. It is my honor to ask Dr. Scott to address our House today and add his perspective on the state of medicine and healthcare. Dr. Scott is the Speaker of the AMA House and a member of the board of the AMA. He is board certified in both otolaryngology and facial plastic surgery. He is currently the president of a 5-physician group and holds a clinical appointment at the University of Louisville School of Medicine. He has also been a mentor to me over the last couple of months and has offered great suggestions and has been very helpful, and his input has been very appreciated. So without any further, I will introduce Dr. Scott. Thank you, Doctor.
Thank you. Mr. Speaker, Madam Vice Speaker, Bill and Maria, it's kind of neat to say that to fellow speakers. I don't get very many opportunities. Usually I'm on the receiving end of that. Thank you for the kind invitation. Even if I don't get to experience New York in person, it's still an honor to be able to be here to address your House of Delegates on behalf of the AMA's House of Delegates, of which I have the honor to be the speaker. I do want to say before I begin that your speakers, the MSSNY leadership and staff, have worked extremely hard to convene this meeting under these unusual circumstances. I know they appreciate your patience and your indulgence. I'm sure it will be a great meeting. Over the next several minutes, I want to discuss with you a couple of issues that are on the top of everyone's mind, and then mention a few other topics that I believe are likely of interest to you. It's remarkable to think back on all the changes that have occurred in our lives and in our country since the start of 2020. The COVID-19 pandemic continues to be a major source of disruption, uncertainty, and fear, and perhaps nowhere more than in New York. On behalf of the American Medical Association, I say thank you to all of you who have fought so courageously on the front lines during this pandemic. You have faced long hours, hardships, personal risk, all for you and your loved ones to care for your patients. As a practicing physician myself, along with many of you, I carry the mark of COVID-19 on my mask, on my nose from wearing my mask. And like many of you, I have watched and struggled with my private practice to survive and to recover from this pandemic. I want you to know that the AMA has been engaged in this battle from the very beginning, responding to the urgent needs of physicians and our patients. The AMA has been there, pressing for a scientific and evidence-based response, providing resources for physicians and their patients, and working to help your practices recover and survive this pandemic. Unfortunately, I think we've all seen that this health crisis has become politicized. No matter which side of the aisle that you sit, science needs to be the basis of our response. Our work to provide an evidence-based response goes back to our founding. The AMA was actually created in 1847 to combat rampant quackery that was common in medical care at the time. By developing standards and principles, we helped create accountability in medicine. Today, the AMA continues to raise the alarm and fight the torrent of misinformation and falsehood about coronavirus that are spread online, in social media, and in the mainstream media as well. We must ensure that policy decisions are driven by facts and evidence, not ideology and politics. In order to help physicians care for their patients, the AMA has developed comprehensive, evidence-based resources, including the continually updated scientific information available for free on our JAMA network. In addition, resources for physicians and patients are also available for free on our AMA website at a dedicated portion of the site called the COVID-19 Resource Center. To give you an idea of the impact, the JAMA network has had over 40 million views, and the AMA website has had over 12 million views since February of this year. The AMA has also created physician guidelines to help address the increasing mental health concerns of COVID-19, which your health commissioner detailed for you moments ago. Knowing that other healthcare needs continue, the AMA launched a media campaign to encourage patients to return to their physicians for care, including preventive care and vaccinations. The AMA has also recently launched a national media campaign to encourage the message to mask up, America, everywhere and everyone. We want to stop the spread by spreading the message. We continue to press for the expansion of testing capacity and clear testing guidelines that are based upon science, not politics. Obviously, there's much we don't know yet, and our understanding needs to increase. But unfortunately, one thing has become evident. Communities of color have been hit disproportionately by this pandemic. A Washington Post analysis found that Black communities have 3 times the infection rate and almost 6 times the death rate as white communities. The AMA is calling upon the U.S. Department of Health and Human Resources, as well as state and local health departments and institutions, to standardize, collect, and make public available all existing race and ethnicity data relating to COVID-19, so that we may better understand its true impact and effectively manage a response. Frontline physicians, many of you in New York, must have a safe environment to work with appropriate personal protective equipment and resources. The AMA continues to press for COVID-19 kit expansion and for more protective equipment to be available for physicians and healthcare workers. Working on a very basic ground level, the AMA partnered with Project N95 to provide over 250,000 masks to physicians in America. Now, we know that physicians can't care for patients if their practices don't survive. And we know that many physicians, employed and in private practice, are actually struggling fiscally to recover and survive. The AMA has worked with the administration and Congress to ensure that provisions for physician practices were included in the CARES Act. We combined with the American Hospital Association and the American Nursing Association to ask the administration for $100 billion in support for frontline healthcare providers. In addition, our advocacy continues for further relief for physicians in future legislation. Unfortunately, the skinny relief package, which included some provisions we supported, failed to pass the Senate this last week. Only in DC can a $500 billion relief package be called too skinny. We'll continue our advocacy there as we move forward with other legislation for relief for physicians. In addition to support physicians in their transition to telehealth, we created resources on our AMA COVID-19 Resource Center, which included information on billing and payment for those services. There is no question to any of us in practice that we must keep our patients safe, staff, and ourselves, and that the equipment necessary to do this carries a price tag. So in response, the CPT editorial panel expedited a new code, 99072, which became public this last week. It is, quote, to describe the additional supplies and clinical staff time required while providing evaluation, treatment, or procedural services during a public health emergency. Physicians' practices should not carry the burden alone of the financial challenges of the protective equipment. Recognizing the unique operational and business challenges posed by COVID-19 upon private practices, the AMA has created additional resources specifically for them. These include a financial checklist that provides physicians and administrators within their office guidance and practical tips to help keep their practices afloat during this crisis. And I'm pleased to announce that at the upcoming AMA House of Delegates meeting in November, the Board of Trustees will be recommending the formal creation of a new section, the Private Practice Physician section, specifically focused on the challenges that private practice physicians face during the pandemic and beyond. The AMA continues to listen to physicians' concerns and channel their voices and feedback to the government and other health organizations. Again, I encourage you to visit the AMA COVID-19 Resource Center on our website, ama-assn.org, for more information and to access these resources. Earlier, I mentioned the disproportionate impact COVID-19 has had upon minority populations. That data just simply further confirms the same chronic inequities that have plagued our healthcare system and our society, leading to devastating consequences for Black and Latinx families. At the AMA special meeting in June, our leadership pledged to take action on racism in healthcare and in society. Specifically, we pledged that we would recognize that racism is an urgent threat to public health, the advancement of health equity, and a barrier to the excellence of delivery of medical care to all citizens. Our goals are to champion health equity and promote greater diversity within medical workforce. An important step to this is recognizing that fewer than 12% of our physicians in the United States come from underrepresented communities, even though 30% of our population lives in these communities. At the AMA, we're working to increase physician diversity through scholarship assistance and pipeline programs. This includes identifying and addressing implicit bias that exists in the medical school admission process. To intervene even earlier, we started the Doctors Back to School program, which provides role models for children from minority communities to encourage them to consider pursuing careers in medicine. And beyond the admissions process, we are taking actions with medical schools to include social determinants in medical school curriculum and residency training so that young physicians have a better understanding of the impact upon health. To embed health equity into our association and to all of our AMA actions, last year, the AMA hired a physician who you might be familiar with, Dr. Aletha Maybank. She brings her extensive experience leading health equity efforts in the communities of color in New York City to the AMA. Dr. Maybank joined the AMA as our first health equity officer and is tasked with bringing the AMA Center for Health Equity, which will be an organizational home designed to elevate the importance and sustain the AMA's health efforts in health equity. In my few remaining minutes, I wanted to mention just a couple of other topics. Patients, physicians, and policymakers are deeply concerned about unanticipated medical bills, or so-called surprise billing. The AMA has brought together a coalition of more than 100 states and specialty organizations to work with the lawmakers at the federal and state level to ensure that patients are protected while maintaining incentives for the insurers to negotiate with participating physicians in good faith. Fortunately, the AMA was able to stop a last-minute effort to include onerous surprise contracting provisions in the most recent COVID-19 relief package. With nearly 20 state proposals on surprise billing this year, the AMA advocacy and resources have helped some states enact good laws and helped problematic legislation in other states that would have reduced physicians' ability to negotiate with health plans. Your state of New York has implemented what many consider to be model legislation, and we must protect the scope of that plan. The AMA continues to push for a federal solution which will end the ERISA escape and at the same time protect the good state laws by setting a floor, not a ceiling. I'm not about to suggest that there's a silver lining at all when it comes to COVID-19, but it's encouraging to see the paradigm shift that has occurred in regards to telemedicine. It's been said that telemedicine advanced 10 years in 10 weeks because of the pandemic. For many patients, telehealth became their best option to connect with their physicians, and for many practices, telehealth became a lifeline for their survival. The AMA has advocated forcefully for telehealth as an option for care, an option which should be fairly compensated. During this pandemic, we have worked with CMS to relax restrictions and to begin fair payment for these essential services. The AMA is working hard to preserve the progress that we have made, and importantly, and at the same time, mitigate the risk that has arisen that certain health plans see this as an opportunity to bypass primary care physicians and rather have the patients connect with their corporate physicians or non-physicians in a call center, and we will make it clear that that is not an acceptable option. Similarly, the pandemic has facilitated the expansion of scope of practice for many non-physician providers. Concessions were deemed necessary to provide care during the pandemic. Now we face the challenge that these same groups that stepped up don't intend to step down. The AMA, along with several other medical societies, is responding to legislation that would permanently expand the scope of practice of CRNAs, nurse practitioners, and yes, even pharmacists. Our message is clear that there is no replacement for physicians who must remain at the head of the healthcare team. These are just a few of the many issues the AMA is currently acting upon, and I appreciate your time. As we began to prepare for this presentation, the AMA sent me literally 46 pages of what the AMA is doing across the nation and in our communities on issues ranging from public health, on diabetes prevention, hypertension, gun violence, vaping, transparency in pharmaceutical pricing, opioid addiction, accelerating medical education, and responding to physician burnout issues, removing hassles like prior authorization. But I didn't think you would want me to go through it page by page, so I picked out these few topics that I thought might be of interest to you. I did note while reading your reference committee reports that 37 items in one form or another asked for AMA involvement. Clearly, at least those of you who are writing resolutions understand the scope and breadth of our AMA. I encourage each of you to go to the AMA website for more information. While you're there, consider renewing your membership or even joining up. To those of you who are members, I say thank you. And for those of you who are not currently members, I ask you to think about the challenges that our profession has faced in just these last few months. What challenges lie ahead? Who will be there to respond for our patients, our profession, our practices, and each of us individually? State medical associations, of which you have one of the best, play a very important role. And specialty societies focus on your special needs. But who, if not the AMA, will provide the national response? Perhaps the health plans, the health insurance companies, maybe the hospitals, maybe the hospital association. What about big pharma? They'll be there. Venture capital groups. Or we can always count on the government being interested in fixing healthcare for us. I don't expect anyone to agree with 100% of what AMA has done in the past or what we'll do in the future. But I do believe that the AMA is our best ally as we move forward to whatever the future holds. AMA dues are about $8 a week. Certainly our profession, the future of the healthcare system, and the care of our patients are worth much more than that. Thank you again for all of your actions on the pandemic and beyond. I look forward to experiencing the rest of your meeting, although facing the challenges of a virtual aspect. Thank you again.
Delegates, it is an honor to have you with us, and we look forward to your leadership in navigating the AMA House through difficult times. I would now ask Dr. Tom Medeski to report on the AMA Foundation Fund dedicated to Dwayne and Joyce Cady, and the newly created fund dedicated to David Meza III. Dr. Medeski.
I'm here, Dr. Littre. Dwayne Cady, MD, and David Bernard Meza III, MD, were two of our greatest MSSNY and AMA leaders during my many years as a MSSNY member. They were both good friends and great mentors to me. Thank you, Dr. Littre and Dr. Basil, for this opportunity to honor these two colleagues that have passed this last year, as well as give an update on how their legacies will live on through two funds at the AMA Foundation. As many of you know, the Physicians of Tomorrow program at the AMA Foundation awards $10,000 scholarships to fourth-year medical students that demonstrate financial need and show passion and dedication to the profession. I am particularly proud of the fact that the Medical Society of the State of New York, along with several members of this House, came together to create an endowed fund that supports New York medical students with an interest in organized medicine and who want to practice in the state of New York. It is our way as physicians to pay it forward to the next generation of doctors, as well as preserve the legacy of Dr. Duane Cady. This fund, the MSSNY Duane and Joyce Cady Physicians of Tomorrow Scholarship, has supported 9 students with scholarships over the last several years, including 2 this past June. A special thank you to Dr. Leah McCormick for her leadership in making a second scholarship possible. Both of the outstanding recipients this year are finishing medical school at SUNY Upstate Medical University. Let me give you a brief introduction to Cameron Boshinsky and Gabrielle Sagas. Cameron was born and raised in Buffalo, New York. During medical school, he was awarded a fellowship by the Foundation for Anesthesia Education and Research and won first place for Best Abstract at the American Society of Anesthesiologists annual meeting. He has held several leadership positions, including Anesthesia Interest Group President, Class of 2021 Curriculum Committee Representative, and founded the Association of Native American Medical Students chapter at SUNY Upstate. Cameron has been instrumental in planning an annual pre-admission workshop for Native American pre-medical students and continues to mentor several of the students that he has met. Gabrielle is a first-generation college graduate who intends to specialize in family medicine with a focus on health disparities and working with our most vulnerable patient populations. She hopes to open a community center where her passions for mental health advocacy, health policy and education, fitness and nutrition can come together to serve specifically Black and underserved communities like her own in Canarsie, Brooklyn, New York. As a lifetime leader, mentor, and compassionate physician, I know that without a doubt, Duane, as well as his wife Joyce, would be very proud of these medical students. Thank you to those who continue to give back to this scholarship fund. In addition to medical student scholarships, the AMA Foundation has a long-standing community health program that is dedicated to supporting vulnerable populations and improving health equity. After the passing of our good friends, Dr. David Meza and his wife, Donna Marie, it was important to me and my wife, Sandra, to honor their lives and their practice in a rural, underserved community and take steps to address health disparities and promote health equity. The AMA Foundation and the AMA Center for Health Equity provided a pathway for us to do so. Each year, we will work with the Foundation and the Center for Health Equity to provide more resources to support community-based pilot projects and programs that seek to eliminate the inequities that cause disparities in health and healthcare outcomes. I deeply appreciate that many of you in this virtual room have stepped up to become founding donors to help seek a new and better pathway for better healthcare for all. Leadership, demonstrated for many years by Duane and David, requires at least 3 actions: thanking, asking, and catalyzing change. I thank Duane and David for their meaningful legacy, and I thank each of you for your devotion to our profession and giving so generously of your time, talent, and treasure to help our patients and provide stewardship to our noble profession. I encourage all of us to make a gift to either the MSSNY Dr. Duane and Joyce Cady Physicians of Tomorrow Scholarship Fund or the David and Donna Marie Meza Health Equity Fund by visiting the link on your screen. During this global COVID-19 pandemic, it is even more critical that we catalyze the change for our patients and our profession in small and potentially very large ways. Thank you.
Of how important these funds are for the education of our New York medical students. At this time, it is my great pleasure to recognize the recipient of the Henry I. Feinberg Award, Mark Fox, MD, a former Speaker of this House of Delegates, and a person who has served the State Medical Society in so many leadership capacities, including as MSSNY trustee, is the recipient of that award. Dr. Fox would have received the Feinberg Award on Saturday at our House of Delegates, but because of the cancellation, our in-person meeting could not accommodate that, and Dr. Fox did not get the recognition he deserved. But our appreciation for all his service to MSSNY is not diminished. and personally for Dr. Fox, who has become a great friend and mentor to all of us as speakers. We just tremendously thank you for all of your help. Congratulations, Dr. Fox. I'm now pleased to call upon Dr. Arthur Cooper, currently the president of New York Medical Society, but also the chair of MSSNY Committee on Emergency Preparedness and Disaster and Terrorism Response. This MSSNY committee has instituted a new award this year, and Dr. Cooper will recognize the recipient of the newly instituted David B. Meza III Award for Excellence in Emergency Preparedness and Disaster and Terrorism Response. Dr. Cooper.
Thank you, Speaker Littré and Vice Speaker Basil. It is my honor to present to the House of Delegates the inaugural recipient of the David B. L. Meza III, MD Award for Excellence in Emergency Preparedness and Disaster and Terrorism Response, William M. Valenti. Dr. Meza, in whose memory this award is named, served the medical community in many capacities throughout his illustrious career. Many here may not realize, however, that he was a founding member of the MSSNY Committee on Emergency Preparedness and Disaster and Terrorism Response, as it is now called. Keenly aware of the threat of bioterrorism and the potential for the use of weapons of mass destruction, Dr. Meza undertook extensive training to deal with such problems. Perhaps Dr. Meza's greatest contribution to the committee, however, was his strong belief that physicians be educated on their role during a public health crisis. That contribution continues through Dr. William M. Valenti of Rochester, where he has spent his entire career, save for 4 years at the Medical College of Wisconsin, where he earned his medical degree. Of course, Dr. Valenti, the Maverick, as he is called by his Rochester colleagues, is known by many of us here today for his groundbreaking work in combating the AIDS epidemic. In its early years, which he has chronicled in a poignant account entitled AIDS, A Matter of Urgency, a Doctor's Memoir, the proceeds of which he characteristically donates to Trillium Health's fund to end the epidemic by 2020. But you may not fully realize the depth of his commitment to the Medical Society through his work with its Committee on Emergency Preparedness and Disaster and Terrorism Response, in addition to its Committee on Infectious Diseases. I cite in particular his development and preparation of educational programs for our members regarding all aspects of the emerging infectious diseases the people of our state have faced ever since 2001, when our committee was first formed: SARS-CoV-1, influenza H1N1, Zika, chikungunya, MERS-CoV, and of course SARS-CoV, to name but a few. It is fair to say that no one has done more to educate our members in the nuances of these illnesses than Dr. Valenti, and equally fair to say that his unique ability to get the word out about these new and devastating illnesses, often before anyone else, has likely saved the lives of countless New Yorkers. As such, it is only fitting that he be recognized as the inaugural recipient of the David B. L. Meza III, MD Award before our entire House of Delegates during our annual meeting. Thank you, Speaker Littré and Vice Speaker Basil, for the opportunity to present Dr. Valenti to the House.
Thank you, Dr. Cooper, for an eloquent acknowledgement of Dr. Valenti's contribution to the Medical Society. Dr. Valenti, would you like to address the House?
Yes, thank you. Art, thank you for those good words. I remind people at times like this that I didn't do any of this by myself, so I want to give a shout out to the Preparedness Committee, MSSNY leadership, and especially to Pat Clancy and Melissa Hoffman on staff who keep me on track. Dave Meza was a friend and a mentor and really taught me the value of and how to think about preparedness. And as I've thought about this, I think it's ironic that I'd be here accepting an award named for him while sheltering in place during a pandemic that he helped us prepare for. So it's a very special moment for me. So I thank you very, very much. It's an honor to be here and an honor to accept this award. And I accept it on behalf of our committee and our patients that will all be helped by our efforts from that group. So thank you.
To the House and other attendees that the Student and Resident Poster Symposium had to be conducted virtually this year because of COVID-19. The posters submitted have been posted online and can be viewed at the link you see projected on your screen. We wish to thank our student and resident members for the hard work that they put into this important project every year. Thank you. The cornerstone of our advocacy in Albany is our MSSNY PAC. Would Dr. Thomas Lee, MSSNY PAC co-chair, please say a few words? Dr. Lee.
Oh. Stand by, Dr. Lee. We're going to bring you to the podium virtually.
Dr. Lee. This, ladies and gentlemen, is show business.
Good afternoon. Thank you, Mr. Speaker and Madam Vice Speaker. Good afternoon. This is Tom Lee, MSSNY PAC co-chair. Before I get started, I would like to acknowledge my partner in crime, Dr. Rose Birkin, who is my co-chair. But since, as I said, we respect the time-honored tradition of age before beauty, I get to make this presentation to this distinguished house. As you know, 2020 has been a historical year, and this is only September. The year is not even over yet. Perhaps the term historic is even an understatement. COVID-19, an unprecedented global pandemic, and the subsequent economic shutdown have adversely impacted not just New York State, but the world. Despite the extremely difficult situation we're facing, both economically and interpersonally, MSSNY and MSSNY PAC diligently advocated for New York State physicians and their patients over the past year and have achieved tangible results. For your information, MSSNY defeated executive budget proposal on OPMC due process reduction, as well as turning back the executive budget attempt to offload 50% of the excess liability costs, these premium, to the physicians. MSSNY PAC also worked with other stakeholders to secure liability protection for COVID-related care, and we continue to do so. MSSNY also worked with federal stakeholders to advocate for financial assistance for physicians during COVID-19 shutdown. Targeted managed care reforms, including administrative simplification work group formation, DFS claim denial report, and hastened payment for claims after initial denial were also other accomplishments of MSSNY. Will you advance the slide, please? Next slide, thank you. In the coming year,
Yeah, he said next slide.
In the coming year, retention of COVID-19 liability protections and prevention of further liability expansion will be on our task list. Further work is also needed to secure future federal and state financial and PPE resources for physicians. Improvement of physician practice environment by reduction of administrative burden, further insurance reform, adoption of New York surprise medical bill model at the federal level, and collective negotiation will also be top MSSNY priorities. Oppositions to unreasonable scope of practice bills by paraprofessionals have been the focus of the ongoing joint efforts between MSSNY and the specialty societies. We urge you not just to be a financially contributing member of MSSNY PAC, but an active member. Please participate in PAC events locally, regionally, and in Albany. and ask like-minded colleagues to join us in our quest. Utilize the Grassroots Action Center to learn important issues and send emails to elected officials. And have your friends, family, staff use them just the same. The number does count. Every voice and every email counts, as you know. Last but not least, participate as Physician Advocacy Liaison, the PLL program, to maintain an ongoing dialogue with the state legislator in your district. Personal relationship also counts. Next slide, please. Despite all the best efforts of MSSNY and MSSNY PAC, leadership and staffs, we need financial support. As shown here on the bar graph are the representative financial resources for PACs in New York. You can see that on the tops are Dental PAC, Law PAC, and SEIU. They all have 3 to 4 times the financial resource of MSSNY PAC. If you look at the expenditure level, the difference is also similarly alarming and striking. We need to reverse the trend. We want to be on the top of the list so we can continue to have our voice heard. Next slide, please. Historically, total MSSNY PAC contribution has been between $225,000 to $275,000 annually. Because of this unprecedented year, we stand at $80,000. Through this House of Delegates, we will give you a periodic update as to our fundraising effort. You all know that this is an election year. The entire New York State legislature is on a re-election ballot. We need to increase our financial resources at MSSNY PAC so we could have our voices heard. The leadership understands the financial difficulty some members are experiencing this year, without a doubt. Just consider, however, if New York physicians had no access to CARES Act revenue-based grants, PPP, or Medicare advance payment, how much worse off we could have been. And those funding would not have been possible to the degree they have been had not been the advocacy efforts of AMA and your MSSNY and MSSNY PAC. Advocacy does count, but advocacy costs money. Next slide, please. The House of Delegates is our single largest fundraising event for the year for the PAC. This year's goal for MSSNY PAC for the House of Delegates is $100,000. I ask that all of you, delegates of this great House, to step up, lead by example. That's what we do best. And make your delegation 100% PAC as it has in the past few years. Or you should upgrade to the President's Circle or Counselor's Club to make it really count. This will continue to be the best investment you make for your own future and for your fellow physicians' future. Please text space MSSNY PAC to 52886 or visit www.mssnypac.org. Alternatively, you can go to mssny.org and be routed to MSSNY PAC contribution page. It will only take a minute of your time, but it will be time and money well spent. Believe me, I put my money where my mouth is. Next slide, please. I know I have talked for too long and people want to move on with their major businesses. In closing, I would like to thank our DGA staff, Mo Oster, Pat Clancy, and all the other staffs. I would also like to thank all of you for joining MSSNY PAC or participating in MSSNY PAC events. It is with a unified voice and strong organizational and financial resources that we can continue to do the important work that we all do for all physicians and our patients alike. Without a healthy and thriving physician community, patients will receive suboptimal or less qualified care, and we do not want to see that happen. Thank you, and please have a successful and productive House of Delegation. Thank you, Mr. Speaker and Madam Speaker.
for your time.
Thank you, Dr. Lee. Please note that a major thrust to contributing to our PAC traditionally occurs at this meeting. The PAC needs your contribution today. This is a very important election year. I would like to just state, as one of the leaders that Tom was referring to, that I will go on record as donating $1,000 today to our PAC. And I believe Dr. Basil would like to make a donation as well.
Yes, so thank you, Dr. Littre. I will, by texting my $1,000 donation to MSSNY PAC at 52886, will make a contribution today. And you can do the same.
Jennifer Wilkes is ready and waiting. So thank you.
Thank you all.
The members of the House have received many communications that outline how the business of this virtual House of Delegates will be conducted. However, I will review now the rules of the House. Every credentialed delegate is here as an attendee. Attendees are muted during the meeting. As the meeting proceeds, the status of an attendee can be altered so that he or she may provide a report or provide other information at the request of the speakers. This is controlled by our technical staff and cannot be altered by delegates. To conduct the business of the House, only the consent calendar for that report will be projected on your screen. The full projected on your screen report will be the reference committee report, and it should be printed out prior to the meeting or somewhere else, such as on a tablet, so that you can view it if you need it. Each reference committee chair will be asked to present his or her report. Once the chair has presented the report, your speakers will call for extractions from that report. Please use the raise hand icon on your screen if you wish to extract an item. Let's practice raising hands. If you can find the raise hand icon, please press it now.
Excellent. So
Looks like
far,
we're doing pretty well. Now put your hands down and we'll try it again. Let's pretend there is a bylaws change to have all future House of Delegate meetings in Malone, New York. Please raise your hand if you wish to extract that item. Okay, put your hands down.
wow, just as many people raised their hand for that item as when we were just practicing out of nothing.
It sounds like we won't have a meeting in Malone. So, as you raise your hands to extract an item, we will call on each delegate in the order we see your hands are raised. We're going to do our best on that. When recognized, the speakers will ask you to unmute yourself. A screen will appear prompting you to unmute yourself. Tap your microphone to unmute. Then you should state the number of the extracted of the item that you wish to extract. Please note, when you are unmuted to extract an item, stating your extracted item is all the speaker will accept. There can be no comments regarding your reasoning for extraction. That opportunity existed from August 24th through September 11. When you've completed your extraction, please lower your hand and mute yourself again. You can be muted again by the technical support as well. Once all items in a reference committee report are extracted, the speakers will call for a vote for approval of the remaining consent calendar in the reference committee report. This is just the way it's done at our House. Please note, the delegates need to pay attention during the extraction period. If you see that the item you wanted to extract has already been acted on, please lower your hand to avoid repetition. As items are extracted, they will be highlighted in yellow. To be clear, the consent calendar minus the extracted items will be voted up or down only. That would be after extractions. The vote for the consent calendar will appear on your screen as a yay or nay vote. When votes are cast, we will announce the results. Members of the House will see the vote by percentages, and the speakers will announce the results by the numbers voted. After approval of the consent calendar, we will vote on each extracted item individually. Again, a screen will appear as the speakers announce the item for which the House is voting. Extracted items can be disposed of in two ways. A yay vote refers the item to council, which will likely refer it to a committee where it will be researched, discussed, and reconsidered. It will subsequently be sent back to the council for a final vote on the committee recommendations. A nay vote returns the item to the reference committee recommendation and it is accepted as recommended by the reference committee. So essentially it goes back to the reference committee report as they presented it. The speakers will announce the results of the vote of each item. Once all the extracted items have been voted on, we will move on to another reference committee report. Please note, no item in any reference committee report that was recommended for referral to council should be extracted, since extractions are voted on for referral only. Resolutions recommended for referral by the reference committee will be highlighted in red. Attempts to extract items that are already referred will be declared out of order by your speakers. I hope everybody understands that, because if an item is already being sent by the reference committee for referral, that item will simply go to council. There are only two presentations depart from those rules above, three actually. The updated bylaws will be voted on up or down. You may recall that over the past couple of years, we have been working very hard on cleaning up the bylaws. We can thank Dr. Jaffe and Dr. Goldberg really for doing the yeoman's work on that. And they have basically cleaned them up without making any changes in the substance. So that's the first item. When dealing with the 2019 resolutions presented by the Bylaws Committee, the House will vote up or down individually on acceptance of these resolutions. If a nay vote is the majority, the resolution will not be adopted. And in addition, there is one emergency resolution that will be presented during the rules report and will require a 3/4 vote to be considered for referral. The House must understand that there will be no opportunity to seek a point of order or debate the resolutions. We apologize that that is the way this has to work, but with a limited amount of time, a limited amount of resources, and a Zoom platform that most of us are at best getting used to, it is the only way we could conduct this meeting this year. And as I stated earlier, you can expect a more robust meeting in the future if it must be held virtually. Would Dr. Zapata please present the report of the Committee on Rules, Credentials, and Order of Business? Dr. Zapata. Please note that when there's a delay, it's because we have to search through all of the names to find the individual that we are looking for to present. And that individual can't present. You just went by it. There we go. Dr. Zapata. I will just comment. Because of the unusual circumstances of this year's House of Delegates, most items usually referred to the Rules Committee were dispersed to reference committees for disposal. Members of the House have received the Rules Report prior to this meeting and are therefore informed about the status of late resolutions, emergency resolutions, and reaffirmation items. Dr. Zapata.
Thank you, Dr. Speaker, members of the House of Delegates. Credentials. There are 299 delegates credentialed and entitled to vote. There are no disputed delegations. The registration record of the Committee on Rules, Credentials, and Order of Business shall constitute the official roll call during the House of Delegates. Late and emergency resolutions. As a result of the COVID-19 pandemic, the deadline to submit resolutions was extended beyond the original March 11th deadline. Resolutions received between March 11th and April 1st were noted as late resolutions. Resolutions received after April 1st were noted as emergency resolutions. The Speakers and Reference Committee members earmarked 12 items as urgent. They reviewed resolutions submitted to the House of Delegates this year. Urgent items were referred directly to the MSSNY Council for consideration at the June 4th meeting. Those resolutions were from Governmental Affairs A, Emergency Resolutions 4 and 5, and Late Resolution G. From Governmental Affairs B, Resolutions 101, 102, 103, and 115. From Public Health and Education, Resolutions 167 and 168, and Late B. From Report of Officers Administrative Affairs, Emergency Resolution 3, and Late Resolution F. Therefore, you will not see these resolutions in the consent calendar for that reason. The following resolutions were withdrawn by the authors: Emergency Resolution 1 and Emergency Resolution 2 due to similarity to other items of business. The Committee on Rules and Credentials met on Tuesday, September 8th to discuss Emergency Resolution 4. The committee reviewed reasons the resolution could not be submitted in a timely manner and the urgency of consideration by the House at this meeting. The Committee on Rules, Credentials, and Order of Business recommends that Emergency Resolution 4 be accepted at the 2020 House of Delegates. Reaffirmation consent calendar. The speakers asked the Committee on Rules, Credentials, and Order of Business to review the recommendations for placing resolutions introduced at this meeting of the House on the reaffirmation calendar. Reaffirmation of existing policy means the policies reaffirmed remain active policies within the MSSNY policy database and therefore are part of the body of policy that can be used in setting MSSNY's agenda. It also resets the sunset clock so that such policies will remain viable for 10 years from the date of reaffirmation. The committee recommends that the existing MSSNY policy be reaffirmed in lieu of the following resolutions. From Governmental Affairs A, Resolution 56, 58, 64, 66, and 67, and from Public Health and Education, Resolutions 151, 152, and 160. This year, members of the House who object to reaffirmation of existing policy in lieu of the resolutions cited above may extract those resolutions during the presentation of the reference committee reports. Election procedure. The MSSNY Council is authorized by its bylaws to act for the House when the House delegates is not in session. A special meeting of the Council was held on May 7th, 2020 for the sole purpose of leadership transition. The nominating committee presented its report to the Council, and as the nominees for all the officers, councilors, and trustees for the term starting in May 2020 were unopposed, the Secretary cast one vote for these individuals and they were elected. In order to allow the entire House to participate, the election of the New York delegates to the AMA was electronic. Since the House elects half the number of AMA delegates each year, delegates were instructed to vote for up to 9 candidates. As the nominees for the medical student and resident and fellow section seats on the AMA delegation were unopposed, these names did not appear on the ballot and they were declared elected. An electronic ballot was emailed to each credential delegate on August 31st, 2020 from electionrunner.com. Component societies of the House were informed that the deadline for credentialing delegates was August 28th, 2020 at the close of business. Every delegate was provided a unique ID and key to access their ballot, and the election closed on September 11th, 2020 at 9 p.m. Election results will be published during the House of Delegates at the discretion of the Speaker. The rules for conducting the House of business of the House are as stated by Dr. Littré before. Mr. Speaker, this concludes the report of the Convention Committee on Rules, Credentials, and Order of Business, and on behalf of the committee, I move for its acceptance.
You were muted that whole time. So.
Really? Okay, so I've just been told that we were muted the whole time from before, so let me start again. Before we end the rules report, we will be dealing with EM4. So I would ask Lori to project EM4. EM4 was the only emergency resolution not dispersed to a reference committee or council for disposal. The House will consider it now. You see it before you. Emergency resolutions must be accepted as business of the House by a 3/4 vote of the delegates attending this meeting. If the House votes to accept the resolution, it will be referred to council. If the House votes nay, the resolution is not accepted for further consideration at this meeting. So I would like now to vote on emergency resolution 4. We are now voting to whether or not to consider it as part of the business of the House, and it will require a 3/4 vote. So we will proceed with the vote.
You have 20 seconds. Okay, 5 seconds.
They can't hear you.
And start.
Okay. So the House has voted 85% to 15% to refer this item to council. So this item, has voted 85% to consider this item as part of the business of the House. So we will now vote on whether this item should be referred. So that will be our next vote. A yay vote will refer this item to council, and a nay vote will basically end its life in this House. So we will now vote on referral. This is a simple majority. Okay, this item will be referred to council. The vote was 79% to 21%, or 142 to 38. Thank you very much, members of the House. If any delegate feels that a new emergency resolution needs to be presented at this House, it should be presented by email, and we will project that email address, and we'll go directly to council. So if you do have an item that you really wish to address soon, that would be the way to do it. Please note, it cannot be a rewording or a re-representation of any resolution currently being dealt with by this House. However, any resolution can be reintroduced at the 2021 House of Delegates. And that will conclude the rules report. Absent objection, the rules and credentials report is adopted. Dr. Zapata, your closing remarks.
Thank you, Dr. Speaker. I'd like to thank the members of the Rules and Credentials Committee, namely Dr. Nabil Kiridli, Dr. Peter Liebert, Dr. Rialba Rodriguez Iglesias, Dr. Jeffrey Snyder, Dr. William Zerhelen, as well as William R. Littre, MD Speaker, Maria A. Basil, MD Vice Speaker, and Laurel Mayer staff. Thank you.
Thank you, Dr. Zapata. So now I would like to call up the House Committee on Bylaws. The first bylaws presentation will be to vote up or down on the bylaws update. Would Dr. Jerome Cohen please present the bylaws report to the House? We have a link that will get us to that bylaws update. Go ahead, Dr. Cohen.
Excellent. Thank you, Mr. Speaker. Members of the House of Delegates, For 3 years, the House Committee on Bylaws worked to update the MSSNY bylaws and remove redundancies. The proposed updated bylaws were presented to the 2019 House of Delegates for consideration and discussion during the House Committee hearing. Testimony received on the updated bylaws was only positive. They are being presented here for House of Delegates adoption.
Okay. We obviously can't project all of the bylaws, so that link is available for anyone who wishes to review it. The hope is that everybody has already reviewed it. Please note that the Bylaws Committee spent a great deal of time on this. It's very important for the House to understand that the committee made no changes in bylaws substance, only in reformatting the existing bylaws at the time they were reviewed. You have before you the updated, reformatted MSSNY bylaws as they were provided to the 2019 House of Delegates. A yea vote adopts the updated bylaws. A nay vote does not adopt the bylaws. We will now vote. Okay. You have voted 98% to 2% to adopt the updated bylaws. Only 4 folks were dissenting on this, so we really appreciate the House's work on this. Thank you very much. Dr. Cohen, please present the House Committee on Bylaws report on 2019 resolutions.
At the 2019 annual meeting of the House of Delegates, the following resolutions were referred to the House Committee on Bylaws. The committee heard testimony of the 2019 House, which is reflected in the committee's recommendations.
Okay. So the first bylaw is before you. We will project 2019-1. Can we project it?
No.
We need to be able to tell people what we're voting on. At least tell you what you're voting on.
Resolution 219-1 is group and institutional membership.
Yes, we will, please have the delegates, please stand by while we bring up the resolution.
We may ask you to repeat that, Dr. Cohen, in a minute. Most of you hopefully will have your bylaws report in front of you.
Just in case.
Okay, Dr. Cohen, tell us what that bylaw was again, please.
2019-1, group and institutional membership.
We will proceed and vote on that. So
you can vote.
We are voting whether to accept or not accept this bylaw. Here we go. 2019-1, group and institutional membership. Let's vote. Okay, the House has accepted 2019-1 by a vote of 90% to 10%, or 158 to 18. Thank you. Let's now move to 2019-2, pilot membership projects. Again, hopefully you have looked at this and or have it in front of you. We will now vote on item 2019-2. Two 2019-2 has been accepted by the House by a similar vote of 90% to 10% or 152 to 16. We are giving you about 20 seconds for your vote. So that item is now accepted and adopted. We'll now vote on item 2019-3, delay of MSSNY elections caused by weather or other emergency. I guess we maybe consider this as one of those. We'll now vote on this item. You have also voted in favor of this item, 97% to 3% or 174 to 5. I hope that doesn't mean that you all want to do this again. We'll see. We'll now vote on item 2019-4, international medical students. Please vote. You have voted to accept this resolution as well by a vote of 84% to 16% or 147 to 27. Thank you. We will now vote on the last bylaws item, 2019-5, former speakers as permanent members of the House of Delegates. Please vote. You have voted to accept this resolution as well by 83% to 17% or 148 to 31. And that concludes the voting on our bylaws for this House. Dr. Cohen, your closing remarks.
Thank you, Mr. Speaker. Your chairman is grateful to the House Committee on Bylaws members, namely Robert Frankel, MD, Timothy Gabriel, MD, Kier Gerasi Chardulo, MD, Robert B. Goldberg, DO, Robert Hessen, MD, Nina Huberman, MD, Arthur Fougner, MD, Frank Dowling, MD, William Littré, MD, and Barry Sapelowitz, Esquire, James Daring, Esquire, Philip Schuh, and Eunice Skelly. Thank you, Mr. Speaker.
Thank you, Dr. Cohen, for a job well done. So we will now move to Reference Committee A, Governmental Affairs and Related Matters. Would Dr. Koirala please present your report? I'd ask you to come to the podium, but we can't do that.
You can do that to kill time while we're doing that virtually.
Thank you, Mr. Speaker and members of the House of Delegates. Your reference committee recommends the following consent calendar for acceptance.
Okay. So what you see before you is the reference committee report on governmental affairs and legal matters A. Are there extractions? Seeing none. No, I'm just joking.
So, start at the top of the list.
Okay.
Dr. Frischman,
Yes.
your extraction?
Pardon?
Do you wish to extract an item?
No.
See these.
Okay, please lower your hands if you do not wish to extract an item. The raise hand function now is only to extract.
Dr. Rothberg. Oh, Dr. Rothberg lowered his hand.
Can you hear me?
Yes.
Yes, Doctor.
I would like to extract item number 64 on behalf of Suffolk County.
Now, which item is that?
Is that resolution 64?
Resolution 64, item number 15. My apology.
Okay, item 15 is extracted. You will see that it will be highlighted in yellow.
Dr. Jones-Assini.
Dr. Assini. Dr. Assini, you may speak if you wish to extract an item. We can come back to her.
Okay, Dr. White.
Madam Speaker, I would like to extract items number 14 and 17.
Items number 14 and 17 are extracted.
Dr. Stam.
I would like to extract item 10.
Item 10 is extracted.
Item 10 was already.
Oh, yeah, okay. I apologize. Actually, item 10 is 2 resolutions, and they have already been handled by council. So
in a
when you see an item that is highlighted in blue, it means that it is already dealt with. So we cannot extract item 10.
Dr. Jalal. Maybe try Dr. Cohen.
I'm sorry, I don't have anything to say.
Thank you, doctor. So everyone remember to lower your hands if your item is extracted or if you need to, if you're not currently in lines for extraction. So I have Dr. Diaz.
I just want to make sure that item 17, I see it highlighted in yellow. It has been extracted, yes?
Yes.
And this will go to council, yes?
No, it will be voted on for referral. Let's move on, please.
Dr. Mehta.
Dr. Mehta?
Yes, can you hear me now?
Yes.
Yes, doctor.
So when we are seeing the voting, can we make sure that along with the percentage, we actually have the actual numbers also?
The speaker will announce the numbers.
Of course, yeah, we will announce how the vote goes.
Thank you.
Are there any other extractions? Seeing none, what you have now is the remainder of the consent calendar, absent items 14, 15, and 17. We will now vote on that portion of the consent calendar. All those in favor of accepting the reference committee's report on governmental affairs and legal matters A, please indicate by saying aye. Those opposed, nay. Okay, the consent calendar has been accepted on a vote of 99% to 1%, 187 to 1. Thank you very much. We will now proceed to the items that have been extracted. The first extracted item is Resolution 63, recommendations for lowering healthcare costs. We will now vote on referral. A yay vote is for referral, and a nay vote, if it is the majority, will return that item to the consent calendar. So we will now vote. Well, somebody did their homework. By a vote of 55% to 45%, you have referred this item. That's 98 to 81. We will now move to Resolution 64, item 15, insurers and vertical integration. We will now vote on referral for this item. Let's vote. Referred this item by a vote of 58% to 42%, or 106 to 76. We will now vote on item 17, Resolution 67, continuing certification as a condition of employment or reimbursement. Please vote. Sounds like people came to the House prepared. You have referred this item as well by a vote of 56% to 44%, or 105 to 83. Thank you very much. Okay, Dr. Koirala, your closing remarks, please.
Thank you. Your chairperson is grateful to the committee members, namely Lance Austin, MD, and William Barrick, MD. Your reference committee chairperson also wishes to express her appreciation to Mo Oster and Rebecca Davis for their help in preparation of this report and navigating us through doing this all virtually. Thank you.
Thank you very much for your great work on behalf of the House of Delegates. We also wish you well in the future, should you decide that you would like to pursue a position on the AMA. Okay. Now I would like, it's your call. I'd like to introduce our Vice Speaker to deal with Governmental Affairs B.
Thank you,
Dr.
Mr.
Basil.
Speaker. Thank you, Mr. Speaker. Will Dr. Parda Valaru please come to the virtual podium? And would you please present the report on Governmental Affairs B?
Hello?
Yes, we can hear you now. Thank you.
Thank you.
Dr.
Thank you. Madam Speaker and Mr. Speaker, members of the House of Delegates, your reference committee recommends the following consent calendar for acceptance.
Thank you, Dr. Valaru. So you have before you the consent calendar for the Reference Committee on Governmental Affairs and Legal Matters B. Minus
Are there extractions?
So just to remind the House that Resolution 108 was dealt with at an emergency session of Council, and that the report, the resolutions that are being referred to Council on recommendation of the committee should not be extracted. So we will call for extractions first. And so actually we're going to lower everybody's hands who have raised them now. Okay. So now please, are there any extractions from Governmental Affairs and Legal Matters B?
Dr. Brian White.
Thank you, Mr. Speaker. I would like to extract items number 4 and 5, please. Thank you.
4 and 5 are extracted.
Not many
So,
resolutions left.
Are there further extractions? Seeing none, you have before you the consent calendar for the Reference Committee on Governmental Affairs and Legal Matters B. Absent the extractions of items 4 and 5. All in favor of the consent calendar will vote yes or yay, and all yes. So all in favor of adopting the remaining consent calendar, vote yay, and all against, vote nay. Okay, thank you. So the consent calendar of Governmental Affairs and Legal Matters B is adopted by a vote of 96% to 4%, 179 delegates in favor of adoption and 8 delegates against. We will now go to the extracted items. Item number 4, allowing anesthesiology assistants to be licensed in New York State. All in favor of referral of this item to Council, please vote yay. And against referral and return to the Reference Committee recommendation, please vote nay. Okay, this was a closer one. We have 55% in favor of referral to Council and 45% against referral and back to the consent calendar. So that's 101 delegates in favor of referral, 81 against referral. The item is referred. Next, we have item number 5, Resolution 113, non-physician doctors. And we will now vote for referral of item number 5. Okay, excellent. So we have a vote of 44% in favor of referral to council, 56% or 103 delegates against referral. The item is not referred, which means that this item will go back to the reference committee recommendation for adoption as amended and adopted with the rest of the consent calendar.
Ask for closing remarks.
That concludes our extractions. May we have your concluding remarks?
Thanks. Your chairperson is grateful to the committee members, namely Susan Emerson, MD, David Fishman, MD, Mark Jaskowski, MD, Bipin Patel, MD, and Suresh K. Sharma, MD. Your reference committee chairman also wishes to express his appreciation to Gina Carey and Raja Ali for their help in preparation of these reports. Thank you.
Thank you, Dr. Valaru.
Thank you, Dr. Basil. I would like to apologize for the House for using I instead of yay. In all the meetings that we have where I am, it's I and nay. And so I'll try to do the yay and nay from now on. We're going to take a short break in a couple of minutes, but I would like to take a few moments and recognize the work of our immediate past president, Dr. Arthur Fougner. Dr. Fougner led the Medical Society through some treacherous times during his tenure. I don't think anyone will dispute that. I have asked him to address the House as he would have on Sunday, April 26th, if the House of Delegates had actually gone as originally planned. Dr. Fougner, you have the floor.
Thank you, Dr. Speakers and fellow delegates. I think I've just witnessed more extractions than an oral surgery practice, and there's more to follow, I'm sure. Council, thank God, council is starting at 9 a.m. Perhaps they should start at 9 a.m. Greenwich Mean Time. Anyway, thank you for this opportunity to address you today. My travels throughout New York, I recognize the beauty of the wonderful Adirondacks, attracting hikers from all over. One such hiker once approached the edge of a cliff, reached for his cell phone to take a selfie, and then unfortunately slipped and fell over the edge. He did manage to grab hold of a limb and held on for dear life. After looking down some 300 feet, he looked up and exclaimed, "Lord, if there's anyone up there, please give me faith and tell me what to do." Then he heard a voice from the heavens. "If you have faith, let go." Well, the man looked down again, thought about it, and cried out, "Is there anyone else up there?" Yes, sometimes we just have to do for ourselves. There is no one else up there. For years, we thought we counted. There was a time when MD could have stood for most distinguished. Over time, that kind of morphed into most demanded. Now, too many feel MD stands for mega dummy. Bob Dylan once wrote that 20 years of schooling and they put you on the day shift. Our doctors might add that 30 years of training and they're handing you a keyboard. The other night, I was attacked by hornets. Yeah, that was very unpleasant. But what a metaphor. For physicians are attacked by society's hornets every day. Insurers, not satisfied with prior authorizations, now demand medical records on virtually every patient, seeking new ways to deny payment or wear down the doctor by attrition. Government regularly enacts more unfunded mandates. I know because I'm about to take another one, that re-upping the pain course, which is a pain. The spring's healthcare heroes have all too quickly resumed becoming healthcare zeros. Physicians are portrayed in the press as rent seekers, one percenters, elitists. After all, doctors are rich, right? So what do? Do we continue to suffer those slings and arrows of outrageous fortune, or do we take arms against a sea of troubles? Folks, as noted in the Shawshank Redemption, salvation lies within. We have the bet cells. We just need to shake off some of the cobwebs from that part of our brains which engage in critical thinking. If we can diagnose and treat some puzzling illnesses, we can most definitely come up with solutions. First, we collectively need to realize that everyone thrives on the indulgence of doctors' goodwill. And that, as past president Dr. Leah McCormick once stated, going along to get along is not a winning strategy. The best defense is often a good offense. Now, I'm not saying we be offensive here. What I am saying is what Patrick Swayze advised in that very forgettable film Roadhouse: be nice until it's time to not be nice. There are times when calling BS is not only appropriate, but necessary. A farmer was once famous for training donkeys. When a visitor asked, "How did you do this?" he said, "Kindness is what works." But then he hit that donkey over the head with a 2x4. The visitor exclaimed, "What the heck?" The farmer replied, "But first you have to get their attention." One of my predecessors, Dr. Charlie Rothberg, advised that we be clever. Our current president, Dr. Bonnie Litvack, was clever in enlisting public relations contacts to set up a televised interview with Drs. Rothberg and Dr. Frank Dowling on MSSNY's peer-to-peer program. Dr. Litvack was also being clever, helping to set up a presentation at our council meeting by representatives of a physicians union, and also in working with board chair Dr. Andy Kleiman to establish a GPO for MSSNY. Fellow physicians, we all need each other. To paraphrase Benjamin Franklin, we must all hang together, for assuredly they are hanging us all separately every day. We must do for ourselves. There is no one else up there. And so, as another of our past presidents, Dr. Tom Ragaisky, would conclude, echoing New York State's motto, Excelsior. Thank you very much.
Thank you, Dr. Fougner, for your insightful remarks. The Medical Society and its member physicians were truly fortunate to have you as our president. And having had the opportunity to work with you personally over the past year and times before, and hopefully in times in the future, you're an incredible resource. Thank you again. We are now going to take a short break. I have 3:02. We will convene at 3:12 sharply. I would ask that we think about and proceed with donations to our PAC, and we will put that particular number up again, or that site where you can contribute. It's a very important year, so please think about it and contribute. So we'll now take a short break. Thank you. 1 minute to go, folks. I think we're ready. Okay, would the House please return to order? A couple of quick items. Again, please contribute to the PAC. It's critically important. I'd like also to say that when I said that the House Committee on Bylaws required a majority vote, it was a 2/3 vote, and each one of those bylaws met the 2/3 vote and then some. So I apologize for that. Dr. Chabra, would you please present the report on socio-medical economics?
Thank you so much, Dr. Littré and Dr. Brazil. By the way, you guys have been doing a fantastic job under the circumstances. The preparation work that went into this is really exemplary. You have before you the report of the Socio-Medical Economics Committee.
Thank you, Dr. Chabra. We probably didn't hear everything that you said, but I think we know that you're asking us to accept your consent calendar.
Absolutely.
So what you
And
have before you.
Yep, thank you.
Okay, what we have before us and what you have before you is the reference committee's recommendation for the socio-medical economics RefCom. So are there extractions?
Dr. Paduchian. So when you come up to the
Here you go.
microphone.
I am unmuted now. Thank you so much.
Thank you. Thank you, Dr. Paduchian.
Madam Speaker, on behalf of the Suffolk County delegation, I would like to extract items number 7 and 11. Thank you.
Thank you. Items 7 and 11 are extracted. More extractions.
Dr. Moore.
Item number 2.
Item number 2 is extracted.
Dr. Isaac.
I'd like to extract item 4.
Is that item 4?
And I'm a student for reference.
Item 4 is extracted.
Dr. White.
Madam Speaker, I'd like to extract item number 1. Thank you.
Item number 1 is extracted.
Dr. Diaz.
It appears that Dr. White did my dirty work, and in different garb now I address
Thank you very
that
much,
I
Dr.
agree.
White. Appreciate it. So are there other extractions? So far, items 1, 2, 4, 7, and 11 are extracted. Seeing no more extractions, we will now vote on the consent calendar minus, Michael, can you move that? I can't see. We will now vote on the consent calendar minus items 1, 2, 4, 7, and 11. All those in favor of the reference committee's report minus those items, please say yay. Those that are opposed, nay. Okay. The reference committee report minus the extracted items has been approved by a vote of 98% to 2% or 174 to 4. We will now move to the extracted items. The first item for extraction was item 1, resolution 250, physician burnout as an OSHA issue. And again, I would like to remind everyone, if you vote yay, you are voting for referral. If you vote nay, you are recommending that that item be returned to the consent calendar as presented by the reference committee. Please understand that. So we will now vote on whether to refer item 1. Please vote. Item 1 is not referred by a vote of 56% to 44% or 101 to 79. It will return to the consent calendar. Item 2, resolution 251, insurance payment mandate for genetic counseling. Again, yay vote is for referral, a nay vote is to return it to the consent calendar. Let's vote. Okay, you have voted 63% to 37% or 111 to 65 not to refer. It will go back to the consent calendar as recommended by the reference committee. Item 4, resolution 255, medical interpretive services. Let's vote for or against referral. Item 4 will not be referred by a vote of 63% to 37% or 109 to 64. It also will be returned to the reference committee's consent calendar. Excuse me. Now, item 7, resolution 258, bundling physician fees with hospital fees. Vote for referral. Let's vote. Item 7 is not referred by a vote of 63% to 37% or 116 to 68. It also will be returned to the reference committee's consent calendar. Now, resolution 269, which is item 11, insurance companies collecting deductibles and copays. Please vote. This item is not referred by a vote of 66% to 34% or 115 to 58. This item is also returned to the consent calendar. Thank you very much. Dr. Chabra, your concluding remarks.
Thank you, Mr. Speaker. Your chairman is grateful to the reference committee members, namely Dr. Ernesto Diaz, Dr. Zeb Tainter, Dr. Reggie Knight, Dr. Allison Giordano, and Dr. Luan Giangreco And we could not have done it without the help from Regina McNally and Kim Ten Brook for their help in preparing this report. Thank you very much.
Dr. Shabra, you did a magnificent job. Every single one of your items has been carried and will remain in the consent calendar as you've recommended.
Thank you.
Good work.
Thank you.
Dr. Basil, I would present my vice speaker for the next report.
Thank you, Mr. Speaker. The chair recognizes Dr. Edward Lewis as the chair of Public Health and Education. Dr. Lewis, will you please come to the podium?
For acceptance.
Thank you, Dr. Lewis. House of Delegates, you have before you the consent calendar of the Reference Committee on Public Health and Education. We will now vote on, are there any extractions? I'm sorry.
Okay. Dr. Emerson.
I would like to extract item 18, resolution 161.
Item 18 is extracted.
Dr. Podwell.
On behalf of Nassau County, I'd like to extract item number 19, resolution 166.
Item 19 is extracted.
Dr. Knight.
Thank you, Mr. Speaker. On behalf of the 7th and 8th District, I'd like to extract item 6.
Item 6 is extracted.
Dr. Young.
Item 13, please.
Item 13 is extracted.
Dr. Isaac. Looks
no,
like you took your.
thank you. 13 is already extracted.
Thank you.
Dr. Isaac. Are there any other extractions? Seeing none, you have before you the consent calendar for Public Health and Education minus items 6, 13, 18, and 19. So we will now vote on adoption of the remainder of the consent calendar. Okay, the remaining consent calendar is adopted by a vote of 97% to 3%, 170 to 6. So we will now vote on each item as extracted. Resolution 162, item number 6, regular mental health checkups and or access to hotline for medical residents. Yay, we will now vote on referral to council. Yay, a yay vote refers. Nay does not refer and returns back to the reference committee's recommendation. Please vote now. This item is not referred by a vote of 58% to 42%, 106 to 78. The next item for referral to council is item number 13, Resolution 158, policy related to the sex trade in New York, recommended by the reference committee for adoption as amended or substituted. Please vote for referral. Resolution 158 is not referred by a vote of 54% to 46%. That's 97 to 81. The next two items were recommended by the reference committee for not for adoption. And we will now vote on the extracted items for referral to council for further consideration. A yay vote means it will be referred, and nay will return resolution 161, item 18, to the recommendation of the reference committee. So that's item 18. Let's vote now.
To be clear, that's item 18.
Item 18 is returned to the recommendation of the reference committee by a vote of 63% to 37%, 111 delegates returning, voting nay, and 66 yay votes. The next item is item 19, Resolution 166, New York State Stroke Regulation Simplification. Please vote for a yay vote is referral to council for further consideration, and nay is not to refer and return to the reference committee recommendation. Please vote now. Okay. This item is not referred and returns to the reference committee by a vote of 66% to 34%. That's 122 to 64. Item 19 is not referred. Dr. Lewis, your concluding remarks.
Thank you very much.
Dr. Lewis?
Okay, yep. Your chairperson is grateful to the committee members, namely Cynthia J. Baltazar, MD, Raymond Paoloni, MD, Panjita Parab, MD, William R. Spencer, MD, and Mark Stam, MD. Your reference committee chairman also wishes to express his great appreciation to my good friend Pat Clancy and Maureen Ramirez for their help in preparation of this report. Thank you very much.
Thank you, Dr. Lewis. I will remind the delegates at this time that the raise hand function is only for extractions. And if you have questions or technical difficulties or other matters that need to be considered, please type them into the question and answer box that is available to all attendees. Mr. Speaker?
Thank you very much, Madam Speaker. We are all too well aware the 2020 House of Delegates hit a few bumps in the road due to the current public health crisis. Because of this, Dr. Litvack did not have an opportunity to address the House and speak about her plans for this year. I've been working with Dr. Litvack for many, many years, and she is a soldier. And through a lot of adversity this year, we keep plugging along. Dr. Litvack, please address the House.
Thank you. Let me start by saying again, thank you to our entire House of Delegates, to our physician members throughout the state, and our county and state staff. You have been called and you are rock stars and heroes. Your ethics, courage, strength, ingenuity, and resilience pulled this state through a spring like we've never seen before, the roughest healthcare crisis in recent memory. You are role models for the state and the nation and are the reason that New York currently has among the lowest virus levels in the country. While this year we had to forego our ceremony of presidents, a moving and meaningful part of our House of Delegates, the spirit of that event lives on. Our leadership is a continuum, building from year to year, incorporating the best of the past and welcoming the new, the present, and the future. I thank all of the past presidents that came before me for their service, inspiration, and guidance. This month is Women in Medicine Month, and therefore fitting for our first ever virtual House of Delegates with a female society president. As most of you know, I am the third female president in the history of the Medical Society of the State of New York. However, many may not remember and do not know that I got involved in the Medical Society of the State of New York at the behest of Dr. Ann Sia, our first female MSSNY president. Watching Ann artfully and seamlessly navigate through multiple landmines and successfully build coalitions to benefit New York was mesmerizing. I'm extremely grateful for her mentorship and all that she has given to our entire 9th District delegation. I treasure and admire my 9th District delegation, who are incredibly dedicated and thoughtful leaders. I am proud to call all of you my friends and colleagues. In particular, I must single out Dr. Andy Kleinman, who continues to mentor me on the art of the deal, and Dr. Mark Fox and Dr. Kira Giroxi, who regularly share their expertise on creating effective policy. Also Tom Lee for his abounding energy and sharing his financial and legislative prowess, as well as Dr. Michael Rosenberg for always modeling calm, reasonable, and approachable leadership. And of course, the phenomenal executive directors that I have been privileged to work with throughout the state, but in particular, Stuart Heyman, Brian Foy, and Janine Miller. In the wisdom of our forefathers, the office of the president construct was enacted, helping to provide a seamless transition from one year to the next. Our office of the president meets weekly to discuss, strategize, and plan our agenda. This group lives the model, together we are stronger. It is and has been a true honor to work with and learn from Sam Unterich, Bob Hughes, Andy Kleiman, Charlie Rothberg, Tom Adesky, Art Fougner, Joe Sellers, Parag Mehta, Bill Latreille, Maria Basil, as well as Phil Schuh and our MSSNY Senior Vice President staff, Mo Oster, Pat Clancy, Eunice Skelly, Christina Southard, Lori Mayer, and Regina McNally. I thank all of you for your friendship and for sharing your time, thoughts, worries, and advice. A special thank you to our Executive Director, Phil Schuh, who will be retiring in December, but who will remain at the forefront of our thoughts after spending 30 years at MSSNY, advancing the agenda of the House of Medicine and helping to steer us in the right direction. Phil, we owe you a debt of gratitude and we salute you. Even in the midst of a pandemic, the work of medicine and medical advocacy continued. Over the course of the past year, we have made great strides forward, repealing the religious vaccine exemption, establishing the Maternal Mortality Review Board with confidentiality protections, obtaining reforms for insurance parity for mental health conditions, substance use disorders, autism specters, and obtaining a 20% tax on the sale of vapor products, defeating trial lawyers' wrongful death bill, and maintaining the excess layer of malpractice coverage, as well as defeating the proposal to bypass existing OPMC due process protections. Our success has in no small part been due to the strong leadership of my good friend and our immediate past president, Dr. Arthur Fougner. This year, we continue to build on those successes and to deal with the new and challenging current practice environment. With the pandemic, we have focused on emergency preparedness, with our Emergency Preparedness Committee and our Infectious Disease Committee working tirelessly and in tandem to create useful webinars to share information about COVID, as well as to provide feedback to our New York State Department of Health about testing, tracing, and vaccine distribution. We have met with legislators, the governor's office, the Department of Health, and testified before our New York State legislature, coordinated with the AMA, sent letters to federal legislators highlighting the need for more funds to our New York State physician practices, the woefully inadequate PPE supply chain, the high cost of PPE, and the need for faster turnaround times and community physician access to point of service tests and supplies. We continue to look for ways for our New York State physicians to procure vetted PPE at a reasonable cost and continue to work with the Department of Financial Services, the Health Plan Association, and the legislature on solutions to defray the cost of PPE to physician practices. We have procured and distributed 40,000 N95 masks at cost. And on Monday, tomorrow, we will be offering members access to 6,000 face shields donated to MSSNY by the Ford Company. Our Member Benefits Committee expects to shortly announce the opportunity for MSSNY members to participate in a group purchasing organization that will give our members access to numerous discounts, including PPE. During the pandemic, MSSNY has focused not only on our community physicians, but has also spoken out on the plight of our employed physician members. We raised concerns and objections with the governor's office, the Department of Health, and our New York State legislature, and in the press about unacceptable working conditions and protections that put the health and the safety of our physicians and their families in jeopardy, and the despicable practices of imposing gag orders and sanctions. We also objected to enforcement of non-competes on furloughed physicians, as well as salary reductions and withheld productivity bonuses. This year, a new committee will be formed, chaired by Dr. Arthur Fougner, who is charged with empowering our employed members. Physician wellness has been and remains a priority for our society, and as you heard, for the AMA. This year, thanks to the hard work of Dr. Charles Rothberg, Frank Dowling, Pat Clancy, Kayla Lauder, and the entire Physician Wellness and Resilience Committee, we have made considerable progress. The MSSNY peer-to-peer program is now up and running, and any physician, resident, fellow, or medical student can access a confidential helpline by calling 1-844-P2P or peer, or by emailing p2p@mssny.org, and be connected to a peer who's empathetic, who's supportive, who will listen without judgment and refer you if needed to additional assistance. In addition, just recently, we have now accepted 4 New York State institutions to partner with us on the MSSNY and the AMA Practice Transformative Initiative in order to enact system-level changes which are sorely needed in a continuous learning collaborative format. Advocacy, as you know, is always a priority in MSSNY. And progressive malpractice reform, collective negotiation remain at the top of the list this year, as well as advocating for telehealth payment parity and opposing national surprise medical bill legislation that does not adhere to the tried and true New York model. However, front and center over the past few months has been scope of practice. MSSNY has met with the governor's office and our legislature and testified at a joint hearing of the Senate and Assembly to express our concern with Executive Order 202.55 that continues the waiver of otherwise statutorily required physician supervision for non-physician practitioners, such as nurse anesthetists, nurse practitioners, and physician assistants. We have urged that given our relatively low virus infection rate, that statutory supervision and or oversight requirements be restored as soon as possible. Our MSSNY Scope of Practice Committee has been monitoring this legislative scope of practice initiatives of nurse midwives, nurse practitioners, nurse anesthetists, and others, and is hard at work on a strategy for fighting scope of practice creep in our state. Achieving health equity and gender equity have long been MSSNY goals. Our committee to eliminate healthcare disparities was instrumental in the creation of the AMA Center for Health Equity that is working to embed health equity as part of practice, process, action, innovation, organizational performance, and outcomes. And our AMA immediate past president, Dr. Patrice Harris, personally expressed her thanks to MSSNY at our June council meeting. Our MSSNY committee will play a critical role this year in helping our state to work toward greater health equity by identifying and eliminating inequities through advocacy, community leadership, as well as education. Our Women Physician Committee will also continue to play an important role this year in writing gender equity in our organization and our profession as a whole. This MSSNY House provides shelter, support, and stability for all in the medical profession. It is welcoming and dynamic, and I am proud to be a part of it and honored and humbled to be able to serve as your president. I am grateful that my children grew up in the House of Medicine, as they have learned much from our passion, dedication, ability to share information, and even our ability to argue respectfully. My girls, Sydney, Haley, and Carly, may not ultimately choose medicine as a career, but from us, they have learned the importance of leadership and advocacy, and they will be better people and citizens for having been exposed to our House of Medicine. I thank them and my husband, Craig, for allowing me to take time away from our family to be with and lead my medical family. We as a medical society have learned much and will use our knowledge and leadership skills to guide our state and our country forward out of the worst global pandemic in a century and into a future that includes a healthy and united state and nation. We will do this by adhering to our core values as physicians and Americans, and by honoring the pledge we took this morning, our Pledge of Allegiance to one nation, under God, indivisible, with liberty, justice, and health for all. Thank you, Mr. Speaker and Madam Speaker, for your hard work in developing an online format for our 2020 HOD, and for the privilege of addressing this House.
Thank you, President Litvack, for your energy and your incredible ability. We wish you the best for the remaining months of your presidency and look forward to helping out and joining you in that endeavor. Another person who did not have an opportunity to address our House of Delegates was our Executive Vice President, Mr. Philip Schuh. As many of you know, Mr. Schuh has announced his retirement at the end of this year. Mr. Schuh, please join us and address the House.
Thank you. Can you hear me? Yes,
we can.
Okay. Thank you. Okay, Mr. Speaker, Madam Vice Speaker, delegates, and all other participants. Thank you for giving me the opportunity to address the House of Delegates at this time. It is indeed unusual times, and I hope that everyone recognizes the efforts that have gone into the presentation today. Long hours have been spent by your speakers, your reference committee chairs, other MSSNY leaders and staff in trying to ensure the best experience possible under these circumstances. I presume that at this point in time, everyone now realizes that I am retiring at the end of the year. I've been with MSSNY and the Empire State Foundation for over 30 years, with the last 10 as your Executive Vice President. Therefore, I decided that this would be the opportune time for me to step down. You don't need me to tell you that the profession has and continues to change. How these changes are finalized rests squarely on your shoulders, shoulders of those that have stepped up and devoted an enormous part of your personal life to promoting the profession on behalf of your patients. If I was personally in front of you, as we had been in previous years, this is a time I would ask to give yourself a big round of applause for all the work that you do. So thank you very much. Taking that comment on a more personal note, those that know me know that I have been a high user of physician services over my many years at MSSNY, mostly because I thought I was an athlete in my younger days. From checking into NYU Hospital 29 years ago for my first rotator cuff surgery, staying 3 nights and having a 4-inch scar down my shoulder, to last year's rotator cuff surgery, walking into the hospital at 5 o'clock in the morning, walking out at 2 o'clock in the afternoon with a couple little dots on my shoulder, actually my 4th rotator cuff surgery, so I knew what to expect at that point. but I have personally benefited from the continued advancement of medicine that you have directly been involved in. Fortunately for me, I've had the opportunity to discuss with numerous MSSNY leaders in various specialties what I needed to get fixed. Hopefully with 1 or 2 more surgeries, I will be done. And then my wife could stop calling me Humpty Dumpty. It's truly been a pleasure working with all of you over these years, and I certainly will miss that interaction. I want to take a moment and thank the many county executive directors that I have worked with over the years. Some have actually retired before me. We might not have agreed on all issues, but we truly had the same goals in mind. To all I say, keep up your efforts to provide your members with the services they need so that they continue to see the value in their membership at both the county and state level. I want to thank all the MSSNY staff for the hard work they do on a daily basis on behalf of the profession. Theirs is not an easy job. While in theory, I am the boss here, the reality is that staff is responsive to all of our leadership. And the fact that they are so responsive to leadership, to the leadership's needs and desires, is what makes MSSNY so successful. Dr. Litvack was very brave naming names of everybody. I was worried that I would leave somebody out. And since there are a lot of staff and leaders that I've worked closely with over these 30 years, I just want to say a general thanks to everybody. I don't want to start, as I said, naming names and then leaving somebody out. But I do want to mention both Suzanne Riley and Michelle Nuzzi, who I work with every day. And without their help, I would never be able to manage what I've been involved in up until now. Also, I want to point out that there is another individual, another long-term member of the MSSNY family who is retiring and actually wanted to be retired at the end of the House of Delegates, which would have been back in April. So because we've extended her tenure through this House of Delegates, and I'm speaking of Eunice Skelly, our Vice President of Membership, and I know that all of you join with me in wishing her health and happiness in whatever future activities she embraces. Lastly, I want to thank my lovely wife, Barbara, who has put up with my hectic work schedule, endless meetings throughout the state and country, phone calls, now obviously Zoom calls 2 or 3 nights a week, while always keeping me grounded no matter how hectic my schedule became. I'm actually very happy to say that later on in this week, Barbara and I will be celebrating our 47th wedding anniversary. I thank all of you from the bottom of my heart for providing me the opportunity to basically spend the majority of my working life assisting you, our members, and all of your patients throughout the state. Thank you and stay safe.
Mr. Schuh, we all want to give you our thanks for leading the Medical Society through many ups and downs. You have done a superb job representing the Society in so many venues while keeping it in good financial health. We recognize your extraordinary efforts on behalf of physicians, the medical community, and our patients. On a personal note, in all of the years that I have worked with Mr. Schuh, won't call him Phil, he has addressed me as Dr. Littre, and I have seen him essentially do that with all of us, which is remarkable. I have never seen him lose his temper. He has assured me that sometime in the near future, he will come to Malone to play golf on our beautiful golf course. And at that time, I hope he calls me Bill and I will call him Phil. Thank you.
Thank you.
I'd like now to call Jocelyn Young to the podium to give the report on reports of officers. Dr. Young.
Thank you, Mr. Speaker. The following reports have been referred to this reference committee: the audited financial statements of the certified public accountants for the year ended December 31st, 2019 for the Medical Society of the State of New York and the Empire State Medical, Scientific, and Educational Foundation, Incorporated. I will entertain a motion to accept these reports for filing.
Thank you, Dr. Young. What you see before you is the reference committee's final report on reports of officers. Are there extractions?
No.
Dr. Goldberg.
We'd like to extract from New York County, item number 16, resolution 210, please.
Item 16 is extracted.
Dr. Medeski,
I would like to very humbly request extraction of number 13, Resolution 202, as it requires further work by the council.
Item 13 is extracted.
Leanna Knight,
Thank you, Madam Speaker. Your medical student section would like to extract item number 22.
Item 22 is extracted.
Dr. Miara,
Good afternoon. This is Santiago Miara. On behalf of Nassau County, I want to add the resolution 206. Thank you.
Item
206 is item 23.
Item 23, Doctor. Dr. Miara, is that item 23? We just want to be sure.
That's correct. That's correct. Thank you.
Thank you. Item 23 is extracted.
Dr. Cates. Oh, that was Dr. Miara.
Can you hear me?
Yes, thank you.
Yes, we can.
This is Dr. Cates from Orange County. I would like to extract item 21, resolution 203.
Item 21 is extracted.
Dr. Kimball,
Yes, Dr. Kimball speaking as an individual from Jefferson County. I'd like to extract items 12 and 15.
I heard you correctly. You said you would like to extract items 12 and 15.
That is correct.
Items 12 and 15 are extracted.
Dr. Parikh,
Hi, I would like to extract item 18.
Item 18 is extracted.
Dr. Choi,
I would like to extract item 14.
Item 14 is extracted.
Dr. Fox,
Point of order, Madam Speaker. It's my understanding that item 21 could not be extracted.
Yes, and it should have been highlighted in red. And you are correct, Dr. Fox. Item 21 cannot be extracted. It is already earmarked for referral. Both 21 and 20 should be marked in red. That's been our cue, so I apologize. So item 21 will not be extracted. It is already earmarked for referral.
and then Dr. Parikh.
Yes, I'm sorry. I also wanted to extract number 19. So both 18 and 19. Thank you.
Item 19 is extracted.
Mr. Speaker, I see no one else at the microphone.
Are there any other extractions? So what you have before you is the reference committee's report on reports of officers. Whoop. Not sure what's going on here. There's another hand that keeps going up and down. Dr. McCormick.
Dr. McCormick.
I'd like.
Oh.
Dr. McCormick, did you wish to extract an item?
Yes, item 25.
Item 25 is extracted. Are there other extractions? Seeing none, what you have before you is the Reference Committee's report on reports of officers minus items 12, 13, 14, 15, 16, 18, 19, 22, 23, and 25. The rest of this consent calendar is up for adoption. All those in favor, please say yay. Those against, nay. Let's vote. Okay, and a vote of 96% to 4%, the consent calendar minus those items that have been extracted has been accepted. We will now move to the extracted items. The first item, which is recommended for adoption as amended, Resolution 200, Annual Demographic Report. We will now vote on whether to refer that item. Again, a yay vote is in favor of referral. A nay vote is not to refer. Let's vote. Okay, you voted 75% to 25% not to refer. So this item will return to the consent calendar. The vote was 129 to 42. We will now move to item 13. Also recommended as adopted. Resolution 202, mentoring. Let's vote. Item 13 is not adopted for referral or not referred. At a vote of 60% to 40% or 106 to 72, the item will be returned to the consent calendar. We will now move to item 14, Resolution 204, improving independent practice opportunities for millennial physicians. Again, yay vote is to refer, a nay vote not to refer. Let's vote. You have voted not to refer this item, a vote of 72% to 28% or 128 to 51. This item will return to the consent calendar. We will now move to item 15, Resolution 209, hostile environment abuse against physicians. Let's vote. For or against referral. The House has voted 78% to 22% not to refer. This item will also be returned to the consent calendar as per the reference committee. We will now vote on item 16, Resolution 210, physician event parity. Let's vote. For or against referral. Once again, you have voted not to refer by a vote of 71% to 29% or 120 to 48. The item will be returned to the consent calendar. We will now move to item 18, Resolution 216, Truth in Advertising. For referral or against, let's vote. You have voted 77% to 23% not to refer. This item also will be returned to the consent calendar. Now, item 19, Resolution 217, defining what constitutes appropriate use of terms residency and fellowship. For referral or against, let's vote. This item also will be returned to the consent calendar by a vote of 76% to 24% or 133 to 42. We will now go to two items that were recommended not for adoption. The first is item 22, Resolution 205, increasing millennial and Generation Z physicians in MSSNY. Vote for or against referral. By a vote of 63% to 37%, this item will not be adopted. It will follow the recommendations of your reference committee, will not be referred. Item 23, Resolution 206, IMG membership. For or against referral. Item 23 is not referred and not adopted by a vote of 68% to 32% or 119 to 55. It is not referred. That concludes actually our last reference committee's report. Oh, wait a minute. I'm sorry. Item 25 was on another page. We have one more item. Another item that was recommended not for adoption, Resolution 215, item 25, membership dues equity. Please vote for or against referral. By a vote of 68% to 32%, it will not be adopted and it will not be referred. I believe that concludes this reference committee's report. Dr. Young, it looked somewhat like there was going to be a bit of a bloodbath here, but all of your recommendations have actually stood. Your closing remarks, please.
Thank you, Mr. Speaker. Your chair is grateful to the reference committee members, namely Liana Leung, MD, Maria Lo Tempio, MD, Joseph Menino, MD, Michael Pizzacano, MD, and Brian White, DO. Your reference committee wishes to express its appreciation to Philip Schuh, CPA, Garfunkel Wild, PC, and Eunice Skelly for their help in the preparation of this report. Thank you.
Dr. Young, thank you for your work on behalf of the House of Delegates and your steadfast participation since you were a medical student. I think you're just a resident now. No, I'm joking. It is appreciated. Jocelyn is just a wonderful member of our House. For those members of the House who extracted items which were referred to Council, we would ask that you supply your reason for extraction and additional comments to MSSNY headquarters so that they may be considered by committees and Council. Please send this information to, and we should project HOD comments at MSSNY.org. I don't, Lori or someone could, that you please project that. Please note that any item that was referred, not only will the comments that may occur over the next couple of days be forwarded to committee, but all of the comments over the past 3 weeks will also be forwarded and will be used in a decision-making process. They will be filed with the resolution. Again, all of that information. Please be sure to indicate the reference committee and item number when responding. Are we going to be able to project? It's HOD comments, COMMENTS at MSSNY, MSSNY.org. That's HOD comments at MSSNY.org. If there are any questions, you can get in touch with our staff on Monday. I will now ask any member of the House who may have a point of personal privilege, talking about personal privilege. We will have a brief period of time for anyone who would like to make a comment. They may have an announcement that's important. They may want to tell us that everybody in their delegation is now a member of the PAC at the chairman's level. That would be great. So we will proceed. Dr. Medeski.
Thank you, Dr. Littre. I just wanted to echo Dr. Litvack and thank you and Dr. Basil for pulling this off in a very good fashion. It was a very difficult task, took a lot of time and energy, and I want to thank you both for your leadership.
Thank you, Dr. Medeski. Dr. McCormick.
Thank you very much. Can you hear me?
We certainly can, Doctor.
Thank you. I would like to make a comment and say thank you to MLMIC, the insurance company. They were extremely generous in providing the needed funds to obtain the second scholarship for the AMA Foundation's MSSNY Katie Physicians of the Future second scholarship this year. And without them, it would not have been possible. And I owe a debt of gratitude to Mr. Michael Shopman and Dr. Lombardo and all the others at MLMIC for accomplishing that. They truly stepped up to the plate to help us. Thanks.
Thank you, Dr. McCormick. That was on the list of things to final comment on, but I really appreciate you doing this. The amount of work you have done for this organization and for that foundation is nothing short of amazing. So thank you. Dr. Rothberg.
Thank you, Mr. Speaker. I would like to take a moment to recognize our speakers. They are due special recognition. Under normal circumstances, you rigorously prepare and test processes leading up to our annual House of Delegates. This year was under exceptional circumstances, where no amount of preparation could possibly have anticipated all of the challenges that you faced. But through enormous thoughtfulness and hard work, it seems that you did achieve what you achieve in ordinary times, and we thank you. In the words of past AMA President and MSSNY Speaker Nancy Nielsen, the job of the Speaker is to get the House where it wants to go. In that spirit, Dr. Littre and Dr. Basil deserve enormous recognition for a job well done. Thank you, speakers.
Well, thank you, Dr. Rothberg. That's very nice. I will comment for both of us that this has been quite a job. And but through it all, we had a great deal of help, and it's been an adventure. This has never been done. We're on a boat in uncharted waters, and I know Dr. Rothberg is quite aware about what being on a boat is all about. So thank you. Dr. Fougner.
Thanks for the unmute. I'd also like to thank the folks behind the curtains there, the folks that had to struggle with enormous technical difficulties in the beginning, and the old Yankee Stadium echo chamber effect and everything else, and straightening it out despite multiple through the storm of text messages I'm sure everybody was getting. And to everybody associated with this event. I know it was an inaugural and hopefully will be a grand series of one, and look forward to meeting with everybody personally the next go round. And thank you very much to both of the speakers for all the hard work, and the folks in the reference committees for getting this job done. Thank you very much.
Thank you, Dr. Fougner. I will point out, however, that there are no curtains here. We have a bunch of rooms, but fortunately no curtains. Your message was well received, however. Dr. Mehta.
Yes, I would like to echo what everyone else has said so far, that speaker, vice speaker, and Lori and Michael Reyes, Sandy, the staff behind the scene, making it possible which once looked impossible. You did excellent job. And one more, my deep gratitude to Phil Schuh and Eunice Scaly, the two of them who are retiring. And thank you all, even all the delegates who participated on this Sunday, 3 hours, and running between the two computers. So thank you all for making it possible.
Thank you, Dr. Mehta. Dr. Lee.
Thank you, Mr. Speaker and Madam Vice Speaker. Thank you for an excellent House of Delegates given the very difficult circumstances. MSSNY PAC would like to acknowledge that we have raised in the last 2.5 hours versus the 3.5 days of the House of Delegates, approximately over $15,000 thus far. We would like to greatly appreciate and acknowledge Drs. Mehta, Latrell, Basil, Lorenzani, Rosenberg, Sia, Klitsky, Nozo, Mike Mager, Barrick, Bukowski, Strasser, Austin, Ang, Kainer, Wetteroo, Helen, August, Stern, Cartel, Thompson, Fox, Gold, Maltus, Perez, Lucan, and Roth for their donation and contribution to the PAC. Thank you all very much, and thank you the speakers for your support of the PAC.
Could you repeat that number, that total number, please, Dr. Lee?
15,300 in 2.5 hours. We can definitely beat our goal over the next couple of days if this process continues, and we will send out a reminder to all the delegates, committee chairs, members, counselors, and officers. Thank you.
Thank you, Dr. Lee. And again, please donate. You can do that anytime between now and I guess till you check out. We would be happy to accept any donation that you can afford to give the PAC. Dr. Maldonado. Joe? Joe, you have to unmute if you'd like to say something. Well, at this point, we are unable to make contact with Dr. Maldonado.
Although Dr. Maldonado, it's not, on your mute icon on Zoom, it's actually on, it'll be in the pop-up box that comes up asking you to unmute.
Okay. Well, the last item of business where are we here? Finally locked. The results of the election for New York delegates to the AMA are ready for publication. We are going to project them for a total of 1 minute. They will additionally be installed on the website for those who wish to examine them further. And then I have a couple of closing remarks. I would like to congratulate all of those of you that have become delegates. This will start in 2021 and go for 2 years. Again, this report will be available on the website. So if you wish to review this further, please feel free. I personally would like to thank everyone for what I hope has been a successful meeting. It certainly was not the meeting that we had intended way back in December of 2019. No one could have imagined that we would be doing this today. The leadership of MSSNY has been outstanding. It has been a real pleasure to work with everyone, but I have to tell you that without Lori Mayer, who will not be allowed to retire as long as I'm speaker, this house would not have happened the way it did. She's an incredible resource, and Phil Schuh, also an incredible resource. And I'd like to extend a special thank you to Eunice Skelly, whom I've worked with for years and years on the membership committee, an incredible resource also. And we thank you. We wish you well in the future, as we do with Phil. Please indulge me as I recognize MSSNY staff who I have not mentioned specifically. I was going to mention Michael Reyes, but he's hiding back here. Mike did a great job. There's no question. And it's daunting to try to put together a meeting like this, especially when we've never done it. So special thanks to Michael, but also are we going to be able to project the other names? I'll mention Raza Ali, Rosanna Arsenian, who sang our beautiful national anthem, Mo Oster, who has been an incredible voice for us in Albany and has been very helpful to these committees, Sandy Bennett, Zena Carr, Pat Clancy, Pat, another very, very important help to what we do. Rebecca Dawes, Bob Hogan, Lori Mayer, I've already mentioned. Again, she can't retire. Michelle Nuzzi, Brian Petrucco, Maureen Ramirez, Suzanne Riley, who got our sandwiches for us today. Phil Schuh, we've already mentioned, and Michael, and Eunice. Christina Southard, Kim Ten Broek, Julie Vecchione, and Jennifer Wilkes. And I didn't mention Regina McNally. Oh, Regina, our time together on Socio-Medical Economics, lots of fun. I would also like to thank our Vice Speaker, Dr. Maria Basil, who's been very helpful and very involved. She's been kind of with me every step of the way, and it's worked out well. Is there anything else? Seeing nothing, I declare the House of Delegates for 2020 adjourned.